Good afternoon. Hello, North Dakota. Thanks for joining again today. We're grateful for all of our viewers and all of you that take the time to stay informed about this historic period in time. I guess today marks a milestone. As I'm walking in here, I'm seeing a table to my left off camera with cupcakes, and I understand, and a cake, that this is the 50th press briefing. Some of the people here in the room and some of you online have had perfect attendance, so I want to thank you for doing that. And of course, I should maybe note right at the beginning, you can't see him, but Lane is wearing a tie. So first time in 50 thing. Maybe that's part of the celebration. But we are all here and grateful for all of you joining us. And I want to just jump in with a few opening comments. And that is, as we've said in recent days, you've heard me say that right here from the podium, that when we get back to having more transmissible moments, if you will, reopening those limited sectors, those 7% of the jobs in our economy were closed mandatorily, others closed voluntarily. But as we increase activity and increase economic activity, we are increasing the transmissible moments. At the same time, simultaneously, as you know, we've spent the last couple of months really building up our capability in the state in terms of testing and contact tracing, because these are two tools that we need to be able to protect the citizens of our state, both in terms of lives and of livelihoods. So the phase that we're in right now is really about managing risk. At the outset of this, we said that we were going to take the extraordinary actions that we did as a state, as a nation, and as a world to reduce those transmissible moments and to slow the spread, and that was to preserve the medical capacity, the ability to deliver care at the highest levels for disease that is highly transmissible, and also for which there, at the current time, there isn't a vaccine or a cure, if you will. Although there, great advancements are being made even this week in both therapeutic and in significant milestones in terms of vaccine trials. At the moment, we still have a disease for which we don't have a cure. So this is about managing risk. And North Dakota, we've done a fantastic job working together with a heavy reliance on individual responsibility and a light touch from government. And that allows us to both save lives and livelihoods by slowing the spread, giving us time to build up our resources and our capacity for a number of things, including testing and contact tracing, give businesses a chance to develop their operating procedures that protect their customers and their team members, and to make sure that we preserve that adequate medical care and hospital capacity, including that at the highest levels, the ICU level, to make sure that we can save lives if people become extremely ill from this. And so with that, we also have been doing more targeted testing. We've been doing more effort of really trying to follow the positive cases and where they lead us to, and then driving our testing. And we said as we did that, we would expect to see cases increase. And that leads us into today's numbers, because with the good work that we're doing in public health and working with the private sector today, we are confirming our highest day yet of additional positive cases of the novel coronavirus disease, or COVID-19, 102 new cases out of 2,105 tests that were conducted. So that brings today's positive rate to 4.8% among all the North Dakota tests that were completed. And that's, again, higher than our trend line, but it is one that we, again, had predicted that could occur as we got more targeted in our testing versus just testing broad general populations. We also now have tested 59,200 unique North Dakotans, which has resulted in an overall amount of over almost 2,100 positive cases. But when we take a look at the serial testing, which we do on the next slide, we've started to show that. The lighter blue on the top represents those tests that were conducted on individuals who had also been tested previously. And again, for those that might just be tuning in, why would you test someone a second or a third time? Well, if they're a frontline medical worker, someone that works either in a hospital, a clinic, or long-term care, they're very likely that they may have been tested multiple times if they've had exposure to residents or patients that are known positives. And also if people are a negative, for example, in a long-term long-term care facility, but they may have neighbors or people adjacent to them are positive, then we're testing those people regularly to make sure that we're doing the right job of infection control and reducing the spread within facilities. So those are reasons why people would have been tested a second time. So of the 2,105 tests that were completed in the 24-hour period yesterday, Tuesday, 737 of those people had been tested prior, or as we would call them, serial tests. When we take a look at the important number, which is active cases, we see a jump in the number of active cases. Increasing over 60 from yesterday. This reaches a new high in terms of active cases among our previous record of active cases of 739 on May 7th. We have seen 1,302 individuals recover, and sadly 49 individuals have not. So we've got now 49 cumulative deaths of people who've died with COVID. We have 4 additional deaths that are reporting as part of today's reporting period. All of these men from Cass County, 2 were in their 60s, 1 was in their 70s, and 1 was in their 80s. All of those 4 males had underlying health conditions. And again, as always, our hearts go out to those families and those loved ones of these individuals who have passed away with COVID as part of their conditions. When we take a look at the death data, the 49 deaths, about 60% of those are male and 40% of those are female so far in North Dakota. Currently, we have 38 people that are hospitalized. This increases 6 from yesterday, and this also matches our high all-time of 38 hospitalizations. But as we've talked about, again, our medical providers have done a fantastic job of building capability, and so we have thousands of beds in North Dakota, hundreds of ICU beds, and not all of these hospitalizations are in ICU. So again, we're only touching a single-digit percentage of our hospital capacity, so we remain in great shape to be able to care for people at their highest level of need. In terms of the positive rate, cumulative 14-day rate, this is an important one that we look at. And even as we've been out with our targeted testing and really focusing on trying to test those people who we know have been in close contact with other people who have been positive, we continue to see a very low rate of positives over the last 14 days. It's inched up from 2.1 up to 2.7, so we're seeing a little bit of a climb in this in the past week after seeing some nice declines. And again, this is, I think, reflects, again, our targeted testing that we're doing across different areas of the state, including long-term care. When we get to county data, and we still have a large percentage of the cases in Grand Forks and Cass County. In those 2 cases, over 80% of the active cases remain in those counties. In the last 5 days cumulatively, about 75% of the new positive cases in the state of North Dakota have been in Cass County. So that still represents a significant portion of where the new cases are popping up. But you'll see on the next map on active case rate by county with population, you'll see some other counties that gain some additional shading. Trail County, yesterday, again, this is a sort of a word of caution. It's related to rural, and it's related to long-term care, and it's related to those people that may think that all of this is behind us. We know that we're in a position now where not only did we have the highest single positive rate throughout the entire pandemic in North Dakota today, but we also had 3 rural nursing homes, one in Glen Ellen that had 10 cases, one in New Salem that had 9, and in Trail County that had 20, and that's a combination of residents and staff. And so again, as we take a look at like Trail County, which we've never mentioned in the previous 50 briefings here, suddenly jumps up on the map of having a fairly high percentage relative to its overall population. And again, that's again due to our proactive getting out and testing all of residents and all of staff in long-term care. And again, with this invisible enemy, when we test, we know where it is. Then we know how to make sure that we can separate positives from negatives. We know we can have long-term care workers that may be asymptomatic, they can stay at home and they can stop the spread. And so we know that testing and contact tracing and then taking the appropriate action relative to physical distancing, even within a facility, is saving lives. So again, thank you to everybody that's involved in these important efforts. We want to talk about testing next, just in terms of where to get tested. This is a slide that shows locations across the state. We're going to be continuing to update this. This is available on the North Dakota Health website, and so you can go to to that website and look for a spot there. You can also get there through the ND Response website, but we want to post all of those locations. In a briefing I had this morning, it was identified that just at the state lab alone, we've got 16,840 test kits ready to be distributed, and that does not include the inventory that may reside at these dozens and dozens of locations around the state where you can get tested. And again, we've talked about Abbott ID Now machines before. That's the point of care testing. We've got increased focus on getting all those up and running. The state had received from the federal government another shipment of the cartridges that go into those, and so we have shipped to over 20 locations where they have active ID Now machines. We've shipped 120 more cartridge test kits for point of care. And so again, it truly is the case that every place in the state that's available and opening for testing, they have the test kits. If you feel symptomatic, if you've been exposed to a positive, we encourage you to call your provider and get tested. Next topic is about CARE-19, and as you know, we launched our CARE-19 contact tracing app, what we'll call the front end. This is for consumers, this is for individuals. We launched it on iPhone on April 7th, among the first in the country to get one of those up. For Android, 2 weeks later on April 21st, and the app now has more than 33,400 users in North Dakota. South Dakota has also adopted this as their app, and it's at use also in South Dakota. This app, which was based on the popular Bison Tracker app, which was created by Tim Brookings at Proud Crowd LLC, uses a GPS location technology that's built into every smartphone. And as it's been widely reported since then, after we came out with that app, historically, the two biggest providers of operating systems for smartphones, Apple and Google. Google, of course, having the Android operating system, and Apple having as the iPhone or iOS operating system. They joined forces. They've created a new contact tracing technology, which they're calling exposure notification, and it doesn't use the GPS location, but rather relies on Bluetooth proximity. Bluetooth, of course, many would be familiar that Bluetooth is the technology that allows you to wirelessly connect with devices that are close by, whether that's a screen or some headphones or a speaker that's nearby. And so again, this local, very narrow wireless technology can also be used to identify when you're in close proximity to another smartphone. And so Apple and Google technology, they came out with this. This would not have been possible without interoperability between their two different approaches on Bluetooth. But when they came out with that, we made a commitment that we wanted to be among the first states to be able to adopt that new technology. And today there was a national announcement by Apple and Google that included North Dakota as one of 3 states, along with Alabama and North Carolina, that will be among the first 3 states to utilize the exposure notification technology. This is going to be included in a new app, which we've named CARE-19 Exposure. It'll help us improve contact tracing and continue our North Dakota Smart Restart, because we have the opportunity to be able, again, all anonymously, but in terms of identifying people when they may have been exposed to COVID-19, and we can do that in a way that has even deeper levels of privacy than the privacy designs we talked about before. And so our team expects that this app to be available within the next 2 weeks. That's CARE-19 Exposure. The CARE-19 app, which you're familiar with, and for those 33,000 plus users, that's now been dubbed CARE-19 Diary to more accurately reflect that it is a tool for you if you're called by a contact tracer, called as in on the phone, and someone calls you and says, hey, your name has been given to us by someone who tested positive. We'd like to have a conversation with you where you voluntarily share where you may have been over the last 10 to 14 days. And this can be, think of it as CARE-19 diary as a memory aid to help you remember the places you've been, to help you accurately help the contact tracers slow down or arrest the spread of the virus. And in both cases, the data is collected anonymously and usage is always voluntary, so you're in control, and privacy is the center of the design point on both apps. Reminder for people that if they're using this, unlike many other apps, you don't have to provide your name, your email, your phone number, your address. This is a free app to you, the consumer, and the install of whether it's CARE-19 or CARE-19 exposure will generate a 36-digit random anonymous number, and that's the only piece of information that Proud Crowd would have, would be this anonymous server. But with that, we would be able to identify that if you were in a location or near another person who tested positive, there'd be a way to notify you without knowing who you are. So this is a way for you to participate, help protect yourself and your loved ones, and do it in a completely anonymous way. And again, all voluntary, and the data is always in your control. And so again, citizen privacy is the utmost importance to us and to those that are working with CARE-19. And again, we want to make sure that why we're pursuing these technology enhancements on the consumer side is to ensure the best contact tracing possible in North Dakota, and do that in a way that allows us to quickly contain new flare-ups like the ones that we saw today. This allows us, to contain those flare-ups, and it will allow us to keep saving lives and livelihood. It will help us keep moving forward steadily with North Dakota Restart. So if you care about getting back to the way things were, one way to do that is to participate, and you can do it for free. Download the app, and if you become someone who is in close contact with a positive, you're going to be able to provide memory joggers to yourself, and potentially you could get notified anonymously to, again, alert you that you may have been in an area of exposure. And as we get back to more transmissible moments, more people going to restaurants and bars, if there was a breakout, say, in one of those, we could anonymously notify people. This could be a super helpful tool for you. So again, thank you for investigating and looking at and downloading CARE-19 today, and downloading CARE-19 Exposure, the new app, which will be available in a couple weeks. Those will be two separate apps. Additional, we've got a new, I guess we're flipping to a new topic here, so I'll just. The topic relates to additional data that we want to share. We know that we've been providing huge amounts of data on COVID-19 cases during these briefings. In addition to that, there's an enormous amount of data that's been transparently shared through ND Response and the North Dakota Health Department website. But we're committed, to keeping everybody fully informed on what's happening around the state. There is again, we've always been trying to balance HIPAA information as well. You've seen that in the decisions that we've made relative to topics like zip code granularity versus county granularity. And again, we had made a decision early on to share age, to share gender, male or female, and to share the counties that they're in while respecting people's privacy. Nationally, there's been a lot of discussion about data related to the coronavirus pandemic when it comes to questions about race or ethnicity. And when individuals are tested across the country, including in North Dakota, their medical providers may ask them several basic demographic questions. No person person, of course, is ever obligated to answer these questions about race or ethnicity in order to get a test. And we want to make that clear because this is data that was shared voluntarily in some cases. It's important to understand this is voluntarily because of the people that have been tested in North Dakota, about 40% of the individuals chose not to provide an answer to the question that would have identified people by race or ethnicity. And of those that have tested, positive, of the 2,000 or so that of the cumulative, about 16% of those who tested positive were individuals who chose not to provide an answer. So let's just start out and say that 40% of all respondents, 16% of positives, that's a huge data gap. And so again, we caution people as we share some of this data. Based on the tests where people did indicate voluntarily race or ethnicity, the data indicates within that subset, again, there's a huge data gap, but within those that did voluntarily provide, that it does indicate that in North Dakota, minority populations tested positive at a higher frequency than non-minority populations. And by test frequencies alone, those that indicated African American voluntarily tested about 3.5 times more likely than those that would have volunteered to have been a white or Caucasian. And Native Americans who volunteered information tested about 2 times more likely than the white population, and that is 12.2 versus 3.5 in the first case and 7.0 versus 3.5 in the second case. So again, of the positive cases in North Dakota, 37.6% of those people who have self-identified or who have been identified as positive cases, but who also have self-identified on a voluntary basis that they belong to a racial or ethnic minority, are part of that group of positives. And if you break that 37.6% down of all positives, 26.3% of those had self-identified voluntarily as African American or Black. And about 5% self-identified themselves as Native American, and about 6% of cases self-identified as Asian. When we compare that to the population as a whole, based on 2018 census data, the 3.4% of our state population had at that point identified as Black or African American, and about 5.5% as Native American, 1.8% as Asian. But even as we talk about Native American, we talk about the census, again, working really closely with the tribes, we believe that that data from 2018 understates the number of Native Americans in our state. The rough estimate would be that it could be as high as 7 or 8% of the overall population in our state. And again, this is why we're encouraging everyone in the state that lives here and was living here as of April 1st to fill out the census so we can get an accurate count, because that makes a big difference in our federal funding over the next decade. It also can help us more accurately understand public health. But I want to just touch, having shared the data, I want to say that there are many factors that underlie demographic patterns in testing and in test results. And most notably, we know from the contact tracing and from what we've shared here that couple of the areas where we know we've had high outbreaks in long-term care, both among residents and among workers that work in long-term care, and we've also seen outbreaks, as other states have, in highly concentrated environments like manufacturing environments. And so we know that we've seen that. When we think about the kind of jobs that kept on going during this entire pandemic, some people that would have jobs if they're part of the information worker category where they could work from home, and that is the case for a large portion of jobs in many industries, including a significant portion of government jobs where people can have been able to distribute work, digitize the work, and work from home. But when you think about filling the important jobs in our community where you can't work from home, and whether that's individuals that are working in long-term care, whether it's on food service staff or custodial staff, cleaning staff, CNA level positions within long-term care or in regular medical care. When you think about people working in manufacturing jobs where they can't work from home, when you think about all those, when you think about the people who, when you go to a big box retailer during the record amounts of purchases and there actually was stuff on the shelf, you need to think about the people that were there between 11 p.m. and 7 a.m. who are restocking those shelves. And in many cases, these frontline essential workers have not been able to work from home. And depending on their economic and demographic situation, they may find themselves living in higher dense areas of population. In our metro areas, they may live in households that have multi-generational families. They may live in households with just fewer square footage to make ends meet, and they don't have the ability to isolate, say, in a separate bedroom like some individuals might if they tested positive. And we do believe, again, from talking to Dr. Birx about this, the national level, that these are also folks that sometimes that either take public transportation or they share transportation when they're commuting to their work. And in many cases, they may be in a position, an offer that doesn't offer health insurance. They might hold two jobs, for example, that are both, pay, or $20 a week or 20-hour a week jobs. We know in some cases that people would fit in this category might have worked in two separate nursing homes, each at 20 hours, versus perhaps working at a job where, and again, that's the economics of long-term care, where they may have been trying to keep costs down in some of these positions. So people that are hardworking and working hard at roles that are important in frontline jobs make and represent people that are more at risk during the spread of this virus. And it is also a fact that these minorities in our state make up a larger share of the workforce than they do of the population as a whole of the state. And so when we take a look at whether this is an overstatement or understatement, when we look at the statistics, I'm sure some will try to draw conclusions, but we really need to get more data to understand, because the infection rate may be representative of the percentage of those minorities in those particular job categories, as opposed to the percentage of minorities in our state. This is an important distinction because, again, this is in terms of transmissibility, I can't stress this enough, because COVID-19 does not discriminate by race or ethnicity. And this is a limited and incomplete data set, and I would urge extreme caution on drawing overgeneralized conclusions from the data that could potentially stigmatize groups of people that are doing really important work, again, in many cases, caring for our grandparents, great-grandparents, and elders in those long-term care situations. And in conclusion on this, I just have one thing to say: the virus doesn't discriminate, and neither should we. I would also add that the important work that our River Valley COVID Task Force is engaging with over a dozen community groups in the Cass County area to assist on everything from language translation to supporting people, because if you find yourself, if you think that the pandemic is challenging for you, think about if you're doing it at the lower end of the economic scale, where you literally need to keep going to work to make ends meet and can't afford perhaps not to, that again, or if they don't go to work, they may not have people that can take care of them. So again, we're trying to make sure that we've got the wraparound supports. If someone is asked to go into isolation because they've been in contact with someone who's been positive or they test positive themselves, we want to make sure that they actually are in a spot economically where they can effectively isolate for 14 days, as opposed to have to either keep working or keep moving in a way where they might infect others. I want to thank all the local and public health officials around the state. I want to thank the North Dakota Department of Health epidemiologists, the research analysts, analysts that will continue to monitor and dig into this data and try to collect it and see how it intersects socioeconomically in a way where we can do a great job of serving all the citizens of our state. Okay, the next topic is behavioral health. Of course, we've talked about behavioral health at every stop. Ensuring safety for the state's most vulnerable is a vital component of North Dakota Smart Restart. We had some great work this week that we want to share. It was been reported that the North Dakota State Hospital in Jamestown recently administered nearly 500 tests during a 2-day COVID-19 testing event that covered all patients and all team members. Across those 500, only one positive was identified. And so again, a shout out to everybody at the state hospital for doing great work in advance in terms of trying to do their important work, but doing it in a way proactively early on. Starting back in March, the state hospital implemented efforts to ensure safety for patients and team members. They limited group therapy size. They modified treatment setting. They practiced social distancing. They increased their attention and quality of hand washing. They screened all team members on a daily basis that were coming and going from the facility and other measures. They also, of course, this is a challenging part when we get into these congregate living, but they also put in a visitor restriction policy, and that does remain in effect. And then all new admissions that are entering the hospital, they're still accepting those, but they're being screened and tested for COVID-19. And everyone can play a role in the prevention and spread of this disease, and there have been some great team members there that have jumped in. One hospital team member with a passion for quilting has been leading an effort with a group of patients to make non-medical cloth masks for people as they're discharged, and yards and yards of fabric and other necessary materials have been donated for this project. So thank you, both patients and staff that are working on that to help create masks for people that as they're being discharged. And then I also want to say too that again, the state hospitals created an environment that not only protects the vulnerable, people that are dealing with the stresses and strains and sometimes the deadly aspects of mental and behavioral health, because mental and behavioral health is just like physical health. Untreated, it can lead to death. And again, so it's often misunderstood, but we're gaining ground in North Dakota and people understanding that the mental health and the disease of addiction and others are real health issues, and we should treat them like health issues. And those that work on the front lines of this are real heroes in my mind. But they can, again, they're doing great work over there on stopping the spread through this proactive testing and following the North Dakota Smart guidelines, both while they're at work and when they're away from work. Another example of great work being done by team members of Team ND across North Dakota. So thank you to all the members and all the leaders at the North Dakota State Hospital. Next update is the Workforce Coordination Council. Since the beginning of COVID-19, more than 850 individuals, and thank you if you're one of those that's watching today, is registered with the Workforce Coordination Council to be matched with open positions in North Dakota, both either on a temporary, a voluntary, or a full-time basis as business and emergency workforce needs change. Today we're highlighting a number of job openings at our own North Dakota Department of Health. Positions that are open there include Disease Info Systems Data Support Specialist, Disease Control Testing Liaisons, Case Investigation, Contact Tracing Regional Managers, Disease Information System Data Quality Coordinators, Healthcare Associated Infection Nurse Consultants, and of course the new system we're putting in on the back end, as we call it, that all of our hundreds of contact tracers will use to coordinate across the state, both state and local, in doing the contact tracing, which is the Dynamics Systems Coordinators. Those positions are all ones that are available, and excellent opportunities because some of these are entry level. So if you're a recent college grad and you had a job offer and that job offer either isn't there or not available, some of these are even temporary positions. If you want to get going and get to work right now, you can apply. More information about location, wages, and other positions at ndresponse.gov/help. And I should notice we talk almost every day here about unemployment statistics, but there are still many businesses in North Dakota with thousands of jobs that are available. So if you are somebody that wants to work right now, you can get a job at North Dakota. And again, you can check out, you can find all the links at ndresponse.gov. And again, thank you for those that have volunteered. Under the good news section, more good news. We want to thank the individuals that are stepping up to make a difference. And today we want to recognize college and university students who have transitioned from their college experience to a distance learning experience, and now they're transitioning in to become important members of our COVID-19 response team. As you may have seen in the news today, there was 8 students in the medical laboratory technician program at Bismarck State College. That's a great program, probably going to be a booming field going forward. It's offered at multiple universities as part of the North Dakota university system, but those 8 students are going to be joining our team at the state lab, so welcome aboard. They're going to be helping to prepare test kits that are there, and again, we've got to prepare thousands and thousands of test kits. That work is going on round the clock to make sure that we are keeping the supply chain going. But their work at the state lab will count as intern credit. It'll free up critical health workers that are doing those tasks now to focus on other important tasks, such as contact tracing, and so we're excited to see this partnership come to life and grateful for the efforts of these students. And we recognize that across the state there are many other students that are involved in the fight against COVID-19, whether working full-time, part-time, or as interns, serving as members of the National Guard, or sharing their time and talent as volunteers, or perhaps they're a nursing student who's also working as a CNA in one of our hospitals or long-term care facilities. So again, thank you for that. Masters of Public Health students, we got great programs at both NDSU and UND. They've formed 3 contact tracing groups to supplement the state's ability to complete that critical task, and of course they're able to do that remotely, tied into that Microsoft Dynamics system. Emergency management students from NDSU are working with our team at the State Emergency Ops Center, assisting with logistics, planning, public information, resource management. A group of students at Williston State College began an initiative to collect resources and donations to support their local family crisis shelter program for vulnerable individuals and families. And these are only a few of the examples of the incredible ways our young leaders are making a difference around our state and our citizens during these challenging times. And so whether you're working with Team ND, serving in local government and nonprofits, making PPE, or volunteering, we're grateful for the resiliency and commitment of these young leaders. And again, reminded again of the importance of our higher education system and the role it plays in our state every day of the year. In conclusion, on gratitude, Douglas Wood said, "The heart that gives thanks is a happy one, for we cannot feel thankful and unhappy at the same time." We know that happiness is one of the things that drives positive health and positive outcomes. And again, for those of you that are feeling like springtime is here and this is a time to be happy, one way to drive your own happiness up is to drive your gratitude up, because gratitude will, as we say, giving thanks is good for the heart. And as Douglas Wood said, you cannot feel thankful and unhappy at the same time. So if you're feeling unhappy, just get a little more grateful to those around you that are making a difference and watch your happiness surge forward. With that, we'll say again, thanks for tuning in, and we're going to go to the favorite part of the program for people right now, which is questions. And we're going with Jack first, and then we're going to go to online.
23 new cases in Morton County today, Governor. Could you address that jump, as well as if it relates to some new nursing home numbers in Glen Ellen, New Salem, and Mandan in recent days?
Directly, the bulk of the number jump in Morton County, if people have a if you have a North Dakota map, if you don't, they're free. They're available at all the rest stops around the state. We got quite a supply of them, but they're fun to have up. I love maps. If you take a look at Morton County is a very large county, and it's a very wide county, and so it goes all the way past. It starts at the Missouri River here, going west all the way past New Salem and Glen Ellen, and the bulk of the Morton County cases are related to the outbreaks at nursing homes in Glen Ellen and New Salem. And that would be the the Holsteins and formerly the Rattlers, if people are into tracking Class B team names, Glen Ellen Rattlers and the New Salem Holsteins. Those two locations, again, are reminders to us that we have some counties that have still not yet had a positive case in North Dakota and should count themselves fortunate, but that does not mean that perhaps the virus isn't present, because these two sort of outbreaks, if you want to call them, were discovered during our intentional effort to test all 218 facilities in the state and all staff in the state. And we'll be doing more retesting. But again, as we move with the excitement towards more opening up, we also, as I said at the beginning, we're taking on more risk, and one of the risk areas is long-term care, congregate living. Okay, Danny.
Renee, Jean, Williston, Harold, we're seeing increased numbers of cases plus more cases in nursing homes, even in counties that have no cases. Will we proceed with updated nursing home guidelines for visitations, as Chris Jones mentioned yesterday? Or is there any thinking that perhaps these guidelines should be delayed until this latest spike drops off?
Well, I think for the question, is that two things on track. We want to continue to develop the guidelines and be thoughtful about the guidelines, work with the Long-Term Care Association, work with what they call the residents. There's a residents sort of representation group as well in long-term care, get input from families. We want to do all that, and then we can have the guidelines ready to go. But then the question is, then when do you implement them is a separate decision, and do we implement them differently by county based on whether or not we've had outbreaks? We want to separate those two things. As Chris said, the team is working very hard to develop a set of guidelines that they're going to try to have done by this weekend, with the idea that maybe the guidelines could be ready by the early part of next week, or I guess after Memorial Day weekend, that those would be ready. But then when and how we time the opening will be a separate decision. So we're charging ahead with developing new guidelines, and again, I'd say this is helpful that it's helpful that now we have the data from testing all the nursing homes. We've got a better baseline with which to begin, but I'd say this is a cautionary note from the 3 in 1 day, and Mayville, Glen Ellen, and New Salem, all three communities that had little presence before, end up with having a large number of cases in a single day. Okay, Jacob, and then Lane.
Kind of a follow-up on that question. You said you've been speaking with these associations. How long have you been speaking with them, and what are the more central topics of these conversations?
Well, if Chris Jones was here, I would defer to him. He's not here today, but Chris has taken the lead as part of that vulnerable population protection plan, which includes people that are in prisons, people that are in shelters, whether that's homeless or domestic violence, and people that are in long-term care, and he's taken the lead on that. But I know that he has been, from the beginning of this whole thing, has been in, if not daily, many times a week, in a discussion with the leaders of the Long-Term Care Association, but also because of the testing that we've done and the outreach we've done and the surveying we've done. I mean, the very first week we were in touch with all the leaders of all 218. I mean, as part of the regular process the Department of Health does in terms of inspection. And in a number of cases when we've had these outbreaks, then I am quite certain we've already deployed what they call Operation Deep Clean, which is we come in with staff, sometimes supplemented by National Guard, will come in and assist with cleaning in these facilities. And so I'd say that there's been really, as there has been with the hospitals and clinics, there's been strong collaboration with long-term care throughout. But this is a reminder that we've got to work even more closely together. Okay, Lane.
I was curious.
Question for me: is there a reason for the tie today, or is there a?
It was a partially. I forgot the word I was going with, but we kind of planned it.
Yeah. Dave's got a tie on too. I mean, it's like a big day, 50th. Anyway, thank you.
It's a milestone. Gotta have a little bit of fun.
Yeah.
I was wondering, how do we get the recovery numbers? Does that come just from contact tracers, or do we also get them from medical facilities reporting recoveries? And do you feel like they're lagging or potentially missing some of those numbers?
Lane, with your perceptive questions, I feel like you might have a bug in my office. We spent a good hour today talking about recovery data and trying to make sure that we're being very accurate on this. CDC guidance changed at one point. You might remember we announced that at one point it was 14 days, and then it was a 14-day period, then it was 10 days from the beginning of the onset of the symptoms. Then there was other guidance that you could kind of, to become recovered, you could either pass through the end of that, because the defined recovered includes a concept that you're no longer transmissible, you're no longer able to give it to somebody else. You may still not be feeling 100%. You may not say, hey, I'm ready to go out and do whatever. And if you're someone with underlying health conditions, because again, we've had more people with underlying health conditions in long-term care who have had COVID and recovered than those that have had it and then passed away. But it doesn't mean you're feeling great. There's studies that are out there now that are starting to emerge that suggest there may be longer term respiratory damage to people of depending on their circumstance and age, longer term respiratory damage of people that have maybe permanently lost, or at least more, not permanently, but in a prolonged way lost some of their respiratory function. So then the CDC said, well, there's this 10-day, which is the new standard, where you could kind of time out of your symptoms, and then there could also test out. So if you had 2 tests that were 24 hours apart, and each of those were negative, and these were the nucleic acid PCR tests that we report on every day here. If you had 2 of those that were 24 hours apart that were both negative, that would be another way where you could be deemed negative. And that matters because if you're in a long-term care facility in particular, it matters where you might be housed, whether you're in isolation, whether you're around other people that are positive, or whether you move back into a population of people that are negative. And we believe that there is not with all the changes and everything going on, and the lack of testing and the lack of antigen testing that we had early on, that we just want to keep scrubbing those recovery numbers. The best data that you can get is from our health department website in terms of the recoveries, but as they work through this data, one thing we're also uncovering is that if you would say on a particular day, these are the people that are newly recovered that we would have announced from here. But if somebody figured out that they actually passed their 10-day period 2 days ago, then they would go back and they would add them in as recovered on that day. And so again, this is why the data may appear very fluid because of an effort to get very accurate in terms of matching these moving guidelines and then actually putting it on the day that they would be deemed recovered. So that's the challenges that we're working through on that. But I would steer, if anybody wants to dig into that data with us, because we're certainly digging into it, is dig into it on the North Dakota website where we're sharing all that. That was more than you asked for, probably, but it's all I know right now. We're going to go online, and then we're going to Dave.
April Baumgarten with the Forum of Fargo-Moorhead. Why do you think people have declined to report their race and ethnicity?
April, I can't speculate on what that would be, and there's no data that would allow an answer, so I guess I won't speculate. I'm assuming that I guess I am. If I transition by saying assuming and then answer, I am speculating, but I'm assuming that some people just are saying, hey, it doesn't matter. Virus is blind, doesn't matter, and people that are declining to provide that'd be an interesting study, but if people won't answer the survey, I guess we'll never know why they didn't answer. But it's one of the things where I said just urging extreme caution, because there's giant data gaps in that data, and it would appear that it has to do with more about where people work and the closeness of their living conditions and their transportation. It's fairly clear that that this virus does not discriminate by race or ethnicity, but it is more transmissible for people that work in close contact. Dave?
Just to follow up on something, you had said you were looking for a number of workers in certain positions. You mentioned contact tracing. So are we short of contact tracers right now?
We've got plenty of contact tracers. I believe the title that I said was regional managers. So again, I think we've got a lot of frontline people, students and others, but we're looking probably for people with managerial experience or maybe somebody that used to be an epidemiologist that can help guide and coach and train all of these new contact tracers, because this is a job category that's increased by many-fold in the last months in our state. And so then by definition, the average length of experience of a contact tracer in North Dakota is probably pretty low, because most of them are new to the role. And so again, we're looking for people that could maybe help in a training and supervisory regional manager. And that this is work that can be done from home, because a lot of the contact tracing we're doing like a distributed remote call center. Some places like Fargo are doing, they've actually got a call center in Fargo where people come to work and work the 10-hour shifts there. So it's a mix, but this can be done remotely. Need a telephone and a computer, which we'll provide. Jack, I think you're next, or no, was it Jeremy? It was Jeremy, because Jack's already gone. Okay, all right.
Plans for reopening the Capitol for state employees in public access?
Actually, this is, again, maybe you're sharing the same bug that Lane has, because we had a good conversation with Jace Beeler and the two majority leaders this morning asking that same question. And then actually had a great call today, National Governors Association call with governors around the country. And on that call were the CEOs of some of the nation's largest companies, including IBM, Salesforce, Workday, Johnson & Johnson, Kroger's, lots and lots of folks. I mean, CEOs. There was sort of a CEO roundtable and having this discussion. And of course, and it varies. You know, if you're someone like Kroger's, which is a national grocery store chain, they've hired 100,000 people during this thing, as opposed to laying people off. And so nobody's working from home. If you're IBM, they've got virtually everybody working from home. Again, you've got information workers that can work from home. As they were talking in Ginny Ramadi, who's I guess now was CEO, now chairman of IBM, was talking about it. I think that what she described is what a lot of businesses are going to face, which is people are going to find out they didn't need as much space as they did for information workers. The space that they had may have had people in too close a proximity, because if you're going to have meetings with lower density in the meeting, then you might need more conference rooms where people can spread out. People are going to need more video teleconferencing capability than they've had in the past. And you may think of work as not as the physical place you go is not the only place where work occurs, but it's like a hub. It's a place where people might come together for training. They come together for contact and socialization. You come together for the kind of collaborative work where interaction matters. And then there is also information work, which is heads down, get your work done, which I think a lot of people have learned, including state employees, that they can be very productive working from home if they've got the right home environment and the right equipment. And that's, again, one of the things that got passed by the legislature this last week through Emergency Commission and Budget Section is dollars to improve that work from home experience. Because one of the ways to keep density down in a place like government where we've had no reduction in force, everybody's still doing essential work. But when you, quote, come back to work and reopen the Capitol, it may be a hybrid. It may be that there are certain managers and leaders that come back and work every single day out of the Capitol, and there may be other classes of workers that will come in 2 days a week. Well, and then on the days when they're not there, somebody else comes in 2 days a week. There is a continuity of government team that we assembled early on that includes people from facilities, because this also affects, in all cases, in all office environments, it affects the amount and expenditure related to disinfecting and cleaning and the procedures that you have to go through. And so there is just like a school or a university. I mean, we're talking here about 7,100 state employees across lots of facilities across the state. I think the state owns 1,600 buildings across the state, 24 million square feet, likely more than we need. We've got a real estate study to take a look at that was already in place, supported by appropriation from the legislature. So I think that, again, there will be a new new thinking, new approaches on the best way to work, not only from a health standpoint, but also from a productivity standpoint. And I also think from a customer service, we talk a lot about wanting to treat taxpayers and citizens as the customers they are. And I think, again, if we can create a situation where a citizen can get a service without having to come to the Capitol, that's a good deal. Because if you take a look at people coming to the Capitol to get a service done, they probably live in Bismarck or Mandan, as opposed to that they are, the other 52 counties probably don't have too many people that are utilizing walk-in services at the Capitol. And if we're not providing for the other 52 counties, we need to figure out a way to do that here. And if we've got processes that have been done by mail, can we move those to digital? Having said all that, I would say that we're going to start to see an opening up in the coming weeks. We'll start to see, I think, just in terms of cars in the parking lot right now, I'd say there's a few more people that are coming to work now than there were 2 or 3 weeks ago, and we'll continue to do it. But the key here is that people get their work done. We work productively. We think smartly about how we can do it, better and more efficiently. It's not about a race to try to pack the building with a bunch of people and then have an outbreak in the Capitol. That wouldn't be productive either.
But what about people who want to visit the Capitol for, I guess, like visitation purposes, like the Rough Rider Hall of Fame, take a tour, see the State Museum, visit the State Library?
I think we'll take a look at each of those because, again, as outside visitation and tours are something we would certainly want to look at. The State Library, along with other libraries in the state, will have, I'm sure, a set of operating procedures. And again, with the State Historic Society is in a position to, with all the space they've got, is in a very different situation than where we've got people packed elbow to elbow. I'm getting a signal here that I've got to go to an event. Okay, all right. So we're greeting some returning National Guard soldiers. We thought the event was going to be a little later. They're coming in early, and so I'm going to end this now. Sorry if we didn't get to all the questions online, but I'm sure you understand the importance of getting here to thank these soldiers for their work. And then I'm looking over to Mike Nowatzki. Are we Friday at 3:30? We'll be back Friday at 3:30 again. So thanks all for your question. Thanks for tuning in, and have a great day.